From regular teeth cleaning to surgical dental implants, there's a dentist office in Dublin that does it all under one roof. Wouldn't we all give our eye teeth for easier quality dental care? This dentist office can do just that. Welcome, Dr. Phing Saurer, owner of River Park Dental in Dublin. Welcome, Dr. Saurer.
Thank you for having me today.
You have a specialty procedure at your practice, surgical dental implants. That's not common for a regular dental office to have that procedure performed, is it?
Most general offices will offer implant dentistry, but what they don't offer, usually they're offering just the restorative aspect of it, so placing the crown on the implant. So in my office, I do the surgery and the restorative part. So I place the implant, do the surgery, and then a few weeks later, once it's healed, I place the crown too.
That's really nice for your patients to be able to have it done all by you.
Yes, so I've heard from most of my patients, they don't like being told to go to a different office at a different location because you build that trust and relationship with them.
That's right.
So they just want to go to the same person, and they don't want to have to retell their history, their medical history, over and over again. So they like that I know exactly what's happening from each step moving forward.
Very nice. Who's a good candidate for this procedure?
So anyone that's missing a tooth, you could be missing one to basically all your teeth. So it's a good way to replace a missing tooth.
Yeah, it's really the new way to do it. And what are the advantages to having it done?
So when you have a dental implant, you're just basically putting it into the bone, so it acts like a tooth. The traditional way of, former way of doing it, or older way of doing it, is placing a bridge. So that's basically having 3 crowns that are fused together to close that gap. With an implant, you're actually placing the implant in that bone where the tooth is missing, and then it just acts as its own tooth. So it's easier to floss. It's made of titanium, so it's a metal, so it's not going to have decay. You don't have to worry about decay or needing a root canal on that.
That sounds
implant.
a lot better than the alternative.
Yeah.
What's the procedure like for patients? How long does it last? Is it very uncomfortable?
So it'll last, once it's placed in and it's healed, it'll last basically forever. So the procedure itself, the surgery, doesn't take very long. Most of my patients don't have any discomfort at all. It's very mild. Sometimes they will describe it as just having almost like a pizza burn because their gum tissue is just a little sore.
Yeah.
But it takes about 6 to 8 weeks to heal, and then they come back, and then we digitally scan the implant to put the crown on top of it.
Let's talk about some different situations where one of your patients might need this done. Let's say a 20-year-old athlete gets his front tooth knocked out.
Yeah.
So how long does it take from the time that you're notified of this to the time when he can have a smile again that he's proud to show off?
So again, it kind of depends on the situation. So if he broke off his tooth and he sheared it at the gum line, and it wasn't something that we could restore with a root canal and a crown, then I can extract that tooth immediately and then place an implant immediately, depending on the quality of the bone. Usually when they're 20, their bone's pretty good, so I can do it all at the same time, and then place actually a temporary crown on top of that implant, and they can leave my office that day with a tooth. So they're not missing one.
All right, let's talk about a patient that's missing several teeth. We hear a lot about denture glue, and people may refer to, well, I need dentures, but I bet an implant is a lot better alternative for someone like that.
Yes, absolutely. So implant-supported dentures is one of the latest things that I think a lot of people that wear dentures appreciate, especially for the lower denture, because you have your tongue, which is a really strong muscle, and it tends to dislodge the denture quite a bit. So when you have an implant there, it can basically get screwed into the implants, and it's stable.
And Dr. Saurer, how does insurance work? Are the implants covered by insurance?
Most insurances will cover the dental implants for about 50%. But if it doesn't, we also have a lot of payment options and plans in our office.
Oh, good. Well, that's helpful. How can folks make an appointment?
Well, they come up to us. We're located in the new Bridge Park location in Dublin, Ohio. And they can call us at 614-689-8686 or visit us on our website, riverparkdental.com.
Very good. Dr. Saurer, thank you.
Thank you.